You want to measure something you add to the... how are you ensure that the
some carcinogen.
Because of what you add? But you're on the right track. We know what kind of substances are present in vegetables. For example, what I already said, in carrots, you have a lot of beta-carotene, and you can measure that in the blood. And there are no really other types of vegetables or fruits which will add so much beta-carotene compared to the carrots. So what you can do is measure different substances before and during the intervention in plasma of these patients and healthy persons. And you can only see if they have a decrease or an increase in their intake. If they skip their vegetables for one day, you will not find that out. So that's quite difficult to check if they stick to their diet. Another question?
Why don't you check only vegetarians?
Only vegetarians. Because then the group for which you can ask people to take part of your study will be very small. And then a study will last for 10 years because you have to have a particular amount of persons because of your power calculation. And if you only use vegetarians, then you will need years and years to get the correct number of people. But it's of course interesting to look at this group of people. But of course we want to generalize our outcomes. So if you only use vegetarians, these people, they eat a lot of different things compared to non-vegetarians, tofu or other meat instances. So they have also some drawbacks. Now what we also did is we visited these groups a couple of times. So I went there with my freezer and my phone to give them the vegetables. These were present in bags for one day and they were frozen. So I had to put them there in their freezer, and I came back a couple of days later to bring them the second portion of vegetables, and I gave them exactly enough for the days that I didn't visit them. So for example, I visited them on Monday, then on Thursday, so I knew that all the vegetables had to be out of the freezer. And for us it seems very logic, but for normal people, just to say it like that, if they don't eat the vegetables, they will not throw them away. And if they forget them, it's still present in the freezer. So if I would visit them again and there were vegetables left, I could ask them what happened. So this was also a way of controlling your groups. But these persons were very honest. One lady, she had to taste a bean because she made it for her husband, and she had to taste it if it was well done enough, and she wrote that down that she had eaten one bean. And it was not part of the diet, so she was almost panicking when I visited her that she had eaten one bean. So they are very honest. People who want to participate, because it's not obliged, they are asked to. So if they participate, they are very motivated and really would like to please the scientists as much as possible. So when I visit them, yeah, that's really nice. So,
ik heb al gemest.
Okay, let's continue. Now, from the biopsies, we also isolated the messenger RNA. We did gene expression. We used the same arrays which we also used in the mouse study. The genes which we measured were comparable. Also presentation by a table. You see two groups at 75 grams per day and 300 grams per day. Just another question. Why did we choose these levels of vegetables? You can imagine 75 grams, not that much. 300, it's quite a lot, but why didn't we choose 300 and 600 or 25 and 100? Why these particular amounts?
I guess 200 is recommended.
Yeah, 200 is recommended. It's also the, it's not the actual intake of vegetables in the Netherlands, it's 150. So that's why we doubled the amount and we divided it by 2. So we thought that all the women, they eat 150 grams, so that was their standard diet. And then you would increase that by a factor of 2 and you would decrease that by a factor of 2. The 200 is from which you first start looking and then you see, hey, it's not 200, it's recommended, but what you see is that the 300 grams is so much. If you want to eat 200 grams, when you go shopping in the supermarket, just weigh the vegetables and see how much it is and how little you eat from it. If you have a cauliflower, you eat 4 or 5 persons eat from one cauliflower. It's not 200 grams what you eat there. So you see the different genes that were up and down regulated in these 2 groups for both patients and controls. 58 different genes were modulated, and the numbers in brackets are the genes which were similarly modulated in controls and in patients. So, for example, the 5 genes, from the 15 genes, there were 5 genes in the controls which were also modulated in the patients. In total, 17 genes had a similar response in controls and patients, and 20 of the 58 genes were known to be related to parthenogenesis. Well, this is a distribution of the actual effect of the gene expression. On the y-axis you see the difference in expression, and on the x-axis you see the level of expression. The more it's to the right, the higher the expression of the gene is, the more it's to the left, and the expression of the gene is quite low. What you see is that it's quite a narrow band in the gene expression differences occur, and only a couple of them just pop up. Why do you think that the number of genes were that low? Why didn't we found 200 or 300 genes which were modulated?
Because you tested only a few?
Yeah, we only tested 600, so you don't expect then half of them to be changed. Another reason. Do you expect when you eat something that the homeostasis in your body is completely disturbed? The body tries to keep everything on the same level, so if you eat something, there will be changes, but your body will try to go back to the same level as it was before. If it's not, then I don't think that everybody will feel very good during the day. So it's just because of the homeostasis, we just also change a very minor part of the diet. If you have, for example, a control group, which you have an exploration room at human biology, you can experiment a little bit more, but we only change the vegetables.